This is just a poor kind of design for a belly button, this triangular, I don't really know where this came from, but it has no resemblance to a natural belly button at all. So I'm going to show you a few patients that I've seen over the years who've had tummy tucks done previously and were dissatisfied with the appearance of their belly button and came in to have it evaluated and a recommendation made to repair it. This is a hernia that hasn't been repaired adequately, and that's why you see the bulge there. Occasionally a patient will have this kind of contracted scar. It usually is a result of too much tension along the skin edges that can be prevented with proper technique. Although there are some patients who just have a tendency to form thick scars. This is called suture striations. If stitches are placed, external stitches are placed to bring the skin together, they can leave these vertical marks. This can be totally prevented by using a different kind of surgical closure technique. Internal stitching is what I prefer so that this doesn't happen. This I call the vertical slit. When not enough fat is removed from around the belly button, that fat sort of compresses the skin and a slit forms. This can be prevented as well. And this is probably the most common, where the scar around the belly button is placed too far outward and it looks expanded like a donut. It's very unaesthetic, and there are some ways to prevent this from happening, and I'm getting ready to show you that. So I did some research work on what ideal aesthetics of belly buttons are in the community, and actually reviewed some of the literature and developed a six-step technique for creating a belly button that looks very authentic. A lot of this is very technical, and so I'm going to review these schematics in a methodical way to just give you an idea of the detail that I think is required to recreate a natural appearing belly button. I create little skin flaps that I can advance down to the base of the belly button by making an incision in the skin surface. This fat around the belly button is thin, and I'll show you that in the next diagram. You can see, so I leave a little bit of the dermis of the skin so that I can use that to stitch down to the base of the belly button, because I want a very deep belly button, because that's what looks most natural. This fat, as you can see, has been sculpted out so that we don't have that crowding of fat around the belly button that can compress it and not give it any depth or width. And then if the belly button is too long, it can be shortened. And then the belly button is stitched to the external skin of the abdomen in a very specific way so that the belly button is internalized and the scar is more on the inside of the abdominal skin than on the outside where it's expanded out. And then finally, this is the kind of the final view where the dermis is attached to the base of the belly button. The belly button is deep and has some shape. This is the result of that particular technique. So I hope you enjoyed that. I know it's a little technical, but I think it's useful to understand that some thought and planning goes into creating a belly button that is inconspicuous, probably is the best way to define it. Just something that catches no one's attention. So thank you for your attention today.